usual, I'm going to care for John Doe. He was admitted this morning. Today is April 10, 2018. It's an evening shift already. So I have he has hypertensive crisis. So I did my blood vital signs, and his blood pressure is elevated, and pulse rate is also on the high side. So I have a doctor's order here for John Doe. Date of birth July 6, 1982, under Michael Limin, Dr. Michael Limin, MRN 00123, bed 4 North 4021, and he is allergic to shellfish. So I have an order here. So to start an IV, PNSS 1 liter at 20 drops per minute, hydralazine 10 milligrams IV now, and other medications. So if oral medications, I've already given him the oral medications earlier. So I'm now going to start the line. So this is my doctor's order, and I'm going to compare it with the MAR. So today is April 10, 2018. So order PNSS. So I got my 1 liter NaCl over here. And then I have my, I'm going to get his hydralazine. So I'm going to compare the MAR first. So hydralazine 10 milligrams, hydralazine 10 milligrams per IV now. So those 10 milligrams, 0.5 milligrams of 20 milligram per 1 ml vial. So the time is now, so I will write the time. So the time right now is 7:15. 7:15 is 19:15. So it's patient John Doe, MRN 00123, July 6, 1982, date of birth, 4 North 4021, under Dr. Michael Limin, allergy to shellfish. So I've compared the doctor's order with the MAR, and I'm going to check my PDTM for the medication. So the order is for hydralazine 10 milligrams IV now. So the PDTM says that it is an antihypertensive. So he submitted with hypertensive crisis, and right now he has an elevated blood pressure and increase in heart rate. So I'm going to give this medication now. So it's treatment for severe hypertension when oral route is not feasible, treatment of hypertensive complication of pregnancy or preeclampsia, eclampsia. So reconstitution and stability. So I will check my red cars. So the rate, I will run it. It says here that I should run it. So dilute 10 milligrams in normal saline in 50 ml. So, and then to give over 15 minutes. Rate must be controlled with an infusion pump. So for my equipment, I have my infusion pump right here, and I have the 50 ml NaCl here, and then I have my medication right here. I pulled it out of the drawer. I'm gonna check that later. I'm just gonna check the compatibility first. So it says to dilute in a normal saline 50 ml. So I have that here. Advanced required monitoring, advanced monitoring with blood pressure and pulse rate following administration, and every 15 minutes for 3 rounds. So 45 minutes, I will check every 15 minutes. And then for the dose, it's hypertensive emergency, 5 to 10 milligrams IM or IV direct. May give additional 5 to 20 milligrams, 20 to 30 minutes if required, or 0.1 milligram kilogram IV direct, then 1.5 to 5 micrograms kilograms per minute continuous IV infusion. So I'm choosing to do the IV intermittent and dilute the 10 milligrams in normal saline because I have a vial of 20 milligrams in per 1 ml, and I will reconstitute it in shortly. So yeah, so I will side effects that I will watch out for is hypotension, tachycardia, palpitations, headache, and dizziness. So he was admitted this morning. He already has a line, but it is on a saline. Let me just check. So it's yeah. So yeah, and then I will check my medication. So I pulled it out of his drawer. So I will compare this label with my MAR. So John Doe, MRN 00123, date of birth July 6, 1982, bed 4 North, 4021, allergy to shellfish. So I'm just going to check my medication and my equipment needed. So I already checked the rate, the equipment, the dilution. To dilute in normal 50 ml of normal saline, and then RED's allergy. So he's allergic to shellfish. He is not allergic to hydralazine, so I'm going to give it's safe to give him the hydralazine. And then the reconstitution, I will reconstitute it with normal saline, and reconstitute it with normal saline. And the stability, I will check if my bag is clear and before administration. So I'm going to compare the medication with the MAR. Can you pause, please? Can I borrow your saline? Because I forgot to put the saline vial here. Sorry. Thank you. So I'll reconstitute my. So I have a hydralazine right here. Hydralazine 10 milligrams IV now. So I have a 20 milligram per ml vial for reconstitution. So I will reconstitute it with normal saline, dilute in 10 milligrams in 20 milligrams in 50 ml. So I will perform my hand hygiene first and finish. So I finished checking my MAR. So I'm going to prepare my my hydralazine now. I'm going to get my equipment. So again, it's John Doe, MRN 00123, July 6, 1982, 4021, allergy shellfish, living. So hydralazine 10 milligrams IV now. The dose I need is 10 milligrams. So this is a 20 milligrams per ml reconstitution. So I will need 0.5 ml of the 1 ml of the 20 milligram per ml vial. So I'm just going to disinfect it for 15 seconds. So I have my blunt fill needle here and my 1 ml syringe. I'm going to get my 1 ml. I'll draw an arrow. about 1 ml, and I'm going to put it in my NaCl. Then I'm going to get 1 ml. My needle is aspirating air, so okay. So I'm going to 1 ml. Okay, and I'm going to and then I'm going to put it in my vial to reconstitute my solution. So I'm going to roll it until the powder gets incorporated to the NaCl. So this is a 20 milligram per ml vial, so I only need 10 milligrams according to my MAR. So I will aspirate 0.5 ml of the 20 from this vial. So I'm just going to check the expiration date. So it's not expired, and then I'm checking for the amount of for the solution, if all of the powder has been incorporated in the liquid. So everything is good now. So the solution is clear. So I'm going to get 0.5 ml from my reconstituted hydralazine. Hold on, I forgot to aspirate air. So I got I will get 0.5 of air before putting it into the vial, and draw 0.5 ml of hydralazine. Alright, so now I'm going to label my I'm going to so I got my 10 milligrams hydralazine right now, and I'm ready to incorporate it in my 50 ml sodium chloride. So I'm going to write down patient is John Doe, drug hydralazine, amount is 0.5 ml, dose is 10 milligrams right here, and then added by, I'll put my initial there, base solution is 0.9 sodium chloride. Date is April, so it's April 10, 2018. Okay. And then expiration date for my NaCl is March 2021, and the expiration date for my hydralazine and my NaCl is 2021 for NaCl and 2021 for my hydralazine. So March 2021. So I'm going to so I've just opened this pack from the bag, so I'm going to disinfect the port. Okay. And then I'm going to incorporate my hydralazine. And I'm going to put the label on. Actually, I made the wrong label, so I'll rewrite it. So, hydralazine, 10 milligrams. Patient name, John Doe. John Doe, added by JP. Okay. All right. Date today is April 10, 2018. Okay. And then I will add this one to my bag. And then I will dispose of the syringe in the sharps container. I'm just gonna grab the sharps container over here. Alright, so now I'm going to prepare my primary line. So, sorry, let's dispose everything. So my primary line, so I'm going back to my doctor's order. It's sodium chloride, John Doe, MRN 00123, DOB July 6, 1982, 4021, Limin Michael for the physician, allergic to shellfish, IVF, plain NSS 1 liter at 20 drops per minute. So I'm making an IV tag for, I will label my IV NSS, so date April 10, 2018. I'm just gonna put that on my IV bag. So I'll label it with the date today. And then I'll check the bag for the expiration June 21. I'll check the bag if it's clear and free from any debris. So it's all good. NaCl, plain NSS. So I'm going to prime my IV now. So I'm going to get my new primary tubing. So I need a primary tubing to prime this line. I'm gonna make sure that the clamp is closed. And then I'm going to make sure to uncover the spike and take off my cover for my IV line, primary line. Making sure that I'm not touching anything because everything is sterile. I'm gonna hook it up and then I will get my clamp and prime it. So I'm going to fill the drip chamber halfway and let my bubbles, just gonna close that and check if I have bubbles in my tubing. this out. I'm gonna close the wrap, and then just put the cover here. Pretend that I have a cover. So I'm gonna close that, and I'll use it's okay. Thank you. So I got my cover right here, and then I'll pick it up, and then I will get my IV set. I'll just get my tray. So I will get my secondary line right here, and bring this to the bedside with my supplies. So I got my saline pump, and then I've got my gloves, and then I'm going to get my MAR and my doctor's order. So I will take everything to the bedside. So I'm going to disinfect my hands first, and then I'm gonna go into my patient room. Right now there are no precautions for my patients, so I am going to proceed and go inside the room.
Come in.
So I'll get my doctor's order and my MAR and all my supplies. Hello, good morning, John. It's Jewel again. So I am back. I'm going to give your medication, the hydralazine. So,
Okay.
Can you tell me your first name?
John,
Thank you. Can you tell me your date of birth, John?
1958.
July
blah, blah.
6, 1982?
That's true.
Okay. All right. And then MRN 0123 4201. Okay. And you have allergy with
Yes.
shellfish.
Yes, shellfish.
Okay,
Oh, I hate them.
Oh, I'm sorry. Shellfish is yummy, so I'm sorry you can't have them, John. So I'm just going to do hand hygiene. So I'm going to start an IV line.
Sure.
So you are going to have sodium chloride for your primary line, and I'm going to incorporate sodium 1 liter to run for 20 drops per minute. This is going to keep you hydrated, and this is going to allow us to give the medications that the doctor will order for you, the IV medications.
Okay.
So I'm going to give you hydralazine, 10 milligrams, 10 milligrams with your primary line once I've hooked it up.
Yeah.
And this medication is for your hypertension. I was here earlier. I checked your blood pressure and your other vitals, and
Yeah.
your blood pressure is super high.
Yeah,
so this
I know.
medication is going to help us keep this. I already did my patient education. He knows what he's going to have, hydralazine 10 milligrams. So I'm now going to insert my primary line on my patient's arm. So I'm going to get an alcohol swab. So going to check the doctor's order. Plain NSS 1 liter, plain NSS 1 liter, John Doe MRN 100123421, allergy shellfish. So I have the same here, John Doe NSS. And then I'm going to clean the site for 15 seconds. And then get I've already checked the doctor's order and my primary line, so I will go and sanitize my hands. And then I've already put it in the pump. So I'm going to open a new alcohol swab. I'm gonna assess the site for any signs of phlebitis. There is no redness, there is no swelling, there's no signs of the dressing is intact and dry. So I'm gonna put my gloves on. I'm going to sanitize the port, and then I'm going to flush it. So I'm going to open a new saline flush packet. I'm gonna go and take the air out, and then I'm going to flush the line and see if it's patent. I'm gonna open my clamp here, and then I'm gonna push, stop, push, stop, push, stop, push until I hit 3 ml. Okay, I got 3 mLs in. I'm gonna close that, and then I'm gonna take this out. All right, and then I'm going to take my primary line and open the cap and push it in. And then I'm gonna check from site to source. So I'm gonna turn on my pump first. Okay. And then while I'm waiting for it to turn on, I'm gonna check from site to source if everything is okay. So I got no bubbles. I'm gonna open my clamp. And then new patient, yes. Med surge, yes. Patient ID. And then volume infused. Total volume is 1000 ml. Channel select. I'll have basic infusion, volume to be infused. So my doctor's order says to run it IVF plain NSS 1 liters at 20 drops per minute. So I'm gonna put the rate in. So the doctor's order says plain NSS 1 liter at 20 drops per minute. So I already did my calculation and I got 60 cc per hour. So volume to be infused 1000 ml. Rate is 60 mL per hour, 60 cc per hour. And then I'm gonna hit start. And then I'm gonna check my size to source again to check if everything is clamped and if everything is okay. So everything is good. Open my clamps. And my infusion is running. And now I'm going to insert my secondary line. So I'll make sure that the primary line is lowered down. So I have already checked the compatibility of the hydralazine with my NaCl, and they're comparable. So I'm gonna open it up. I'm gonna check hydralazine. I'm gonna spike it first. So it's hydralazine 10 milligrams, 10 milligrams per IV now. So the time is 9:15. I'm gonna circle that, and then I'm gonna go and put it up, and then I'm going to hook this part. So I'll open I'm gonna open the alcohol swab and disinfect the first port, and then I'm going to get the cap off and insert my secondary line through my primary line. And open it up and prime it. Hold on, just close it first. I'm gonna prime it first. What's that? Yeah. So I didn't realize I didn't prime. Okay, I can prime it from here, right? So how do I do that again?
Make it lower.
Okay, so
You can connect it.
okay, I'll connect it, and then so I'm going to prime my
Open the clamp.
secondary line, and I'm going to lower it down and prime it. So there we go. Chambers half full. So it's before I start, I will select channel and then check hydralazine 10 milligrams, hydrogen 10 milligrams, John Doe MRN 01234021, date, same date, and then I'm going to channel select, secondary. This is hydralazine H. It doesn't have it.
H.
It doesn't
That's
have
the
H.
G. Yes.
H. I have I. This one? No. G. There's no H.
No H.
No H. What the hell? No H.
What is going on here?
No H.
No H.
That's the brand name for. I searched and
Oh.
So okay, so there is no hydralazine in the infusion pump. So I'll just go for a basic set. So I'll go with channel select, secondary, basic secondary. So my PDTM says that to give it over 15 minutes. So volume to be infused is 50 plus 50. Yeah, just and 0.5. So I'll just say 51. And then to give it over 15 minutes. 50.5 ml in here, so I will round it off to 1, so I got 51 ml and I computed the rate. So 51 ml divided to run for 15 minutes and times 60 minutes over 1 hour, so I got 204 ml. 04 ml per hour, and then I'll press primary lines lowered down, secondary line up, hydralazine 10 milligrams IV now. So I'm gonna start and open my secondary line. So it's now infusing, so I am going to document, and then that I've already given it, and then I will watch it for 15 minutes, and then I will monitor my patient for 15 minutes 3 times. I monitor blood pressure and pulse rate following the administration of my secondary line. So I'll just clean up and hand sanitize and return, already documented, and I'll return the doctor's order and the mark.